Good afternoon, welcome. My name's Anne Began and I'm an audit manager at Audit Wales. We're here today with colleagues from Hull University Health Board as part of our COVID-19 Learning Week. In this session, we will hear how colleagues have been managing the wellbeing of staff during the COVID-19 pandemic. Firstly, can I please ask you to introduce yourself and briefly explain what your role is in the Health Board?
Hi, yes, my name is Suzanne Tarrant. I'm a consultant clinical psychologist and I'm head of the Staff Psychological Wellbeing Service for Hywel Dda.
Hi, my name's Christine Davis and I'm the Assistant Director of Organisation Development here at Hywel Dda, having been with the organisation since 2017.
Hi, my name's Maria Battle and I'm Chair of Hywel Dda University Health Board, and I was very fortunate to join the Health Board in August 2019.
Thank you. Okay, first question. Can I ask you, how has your role and responsibilities evolved over the course of the pandemic?
I think I took up responsibility for the OD portfolio, which then took in staff psychological wellbeing in the autumn of 2019. So I'm very lucky to have Suzanne and her team as part of my wider team. And what I'd say in terms of the impact of the pandemic is it became very clear very early on how staff psychological wellbeing was very important to the board and the command structure that was put in place to deal with the pandemic. So I'm a member of the Workforce Bronze Group and report and assure on how we are delivering against our wellbeing plan.
Obviously, as Chair of the Health Board, the most important people that we have, besides the patients that we care for and the people that we serve, are our staff. So staff wellbeing is absolutely crucial, and we know if staff are looked after and cared for and listened to, then patients are looked after better, results improve. And so when the pandemic started to hit us, it was a very scary time for everybody. It was quite chilling at the beginning with the predictions. And I reached out to my colleagues here, which is Christine and Suzanne and other colleagues, to put together a focus group with me as chair, kind of giving it an endorsement and a leadership, because I think it's a privilege to be a chair in an organisation, and what you focus on is important and it gives it priority. And for all of us, staff wellbeing was absolutely and utterly the top priority, and I've been really grateful to learn so much from Suzanne and Christine and other colleagues, and from the lessons that were learned in countries before us, such as China and Italy, and their advice on how to care for our staff, and to hear from our staff and from our communities, who were amazing the way they also stepped up to care for staff. So I think, how has your role changed? It has increased the focus, I would say.
I've been in my role actually within the organisation now for over 17 years, amazingly. So the service has been around for that length of time, working to build a culture of wellbeing and resilience for all of our staff. In terms of the pandemic and the last year, I guess things have just ramped up a lot. We've always taken our responsibilities very seriously and have done what we can within our remit. In the last 12 months, we've tried to plan and develop and be responsive to evolving need in the best way that we can, but also to work more collaboratively across the organisation. So my role hasn't really changed and the responsibility remains the same, but perhaps how I have implemented that, how I work with colleagues has been quite different.
Can I ask, what are you most proud of in your response?
There's actually a lot that we're proud of. In terms of my own sense of pride, I think it's about how hard people have worked. And that goes from our frontline staff through to support staff and our support services as well. The dedication and commitment from everyone has been absolutely extraordinary, and from within my own team as well. as well as across wider workforce and OD. So that commitment and dedication has been extraordinary. And it does instill a real sense of pride. As well as, it's not just about working harder, it's also about being willing to work together and to work differently. Even when things are really challenging, there's that openness to finding new ways to solve issues and to respond to challenges. So yeah, I could probably say a lot more than that, but if I stick with those things for now.
Yeah, I can relate to what Suzanne shared there, but I think one of the things I'm most proud about is that I work for an organisation who really does put staff and our patients at the heart of everything we do. It feels authentic. It doesn't feel something that we say. It feels like something that we do. So that's really important. And for me, I think when I reflect back, part of my role prior to the pandemic was leadership development and developing leaders across the organisation. And those relationships that we had in existence beforehand have really stood us in good stead, I think, in terms of being able to reach deep into the organisation and right across the organisation to, I suppose, provide a bit of a safe haven, create a web of resilience for those, you know. This leadership challenge over this last year has been enormous. So as well as the frontline staff, it's those leaders wondering, how on earth do I do this role? I haven't done it before. So I'm proud of that, yeah.
I'm really, really proud of the sacrifices everybody has made, and as my colleagues have said, and that's everybody, frontline staff back to the leaders, and the sacrifices that their families have made as well. And listening to staff, you know, I'm really proud of the range of resources that have been put in to support staff during this pandemic, and the fleet of footness of it. So Suzanne's been leading on this, and you know, she was very clear that we can't have too many and there must be choice, and we've been quick in putting them into place. But staff right the way across the organisation have talked about how they've looked after each other, how they haven't necessarily used the resources that are available, but they know they're there, you know, from the little cards around the place, they know they're there. And the humour and the camaraderie that's kept people together, and the support, and staff have said the way they've kept their families safe, both physically, some people living away from home, but also emotionally by not sharing their experience and what they've seen, but they've shared it with each other. And for some reason, no matter who you speak to, people haven't fallen over altogether. There's always been, everyone's gone down at certain times, but the rest have helped each other. And people have said to me, it's like the proper creation of families, you know, and there's recognition of how people have become grumpier or more frustrated, but it's being spoken about. Like one of the things that Suzanne put in place was a safe listening place where you could just offload, and staff are saying they can't do that at home because you're protecting your family, your partner, whatever. So I think it's the sacrifices, the care of each other, the humour, and my gosh, you know, it has been a year now, hasn't it? And there's been no let up. In fact, the second wave was worse than the first wave. But I just think everyone has just been amazing.
Looking forward, what is the biggest change or takeaway the pandemic has brought about?
Okay, I think one of the biggest changes in the pandemic, and one of the things I welcome the most, is the change in the way we provide some of our services. So a lot of the bureaucracy through necessity has been absolutely cut away, and people don't want that to be re-established. You know, we don't want the sticky middle. So that's one of the biggest changes, and we've got to take that away with us and not go back to the olden ways. We are so focused on the patient in the constraints of the pandemic that we've got to take that away and continue. I think the other thing is the sadness of the backlog of people waiting, particularly for elective elected care. Here in Howell Dar, we were about to get down to 0 people waiting more than 36 weeks. I think we're around 30,000 now, and that really worries everyone. There are people in pain, there are clinicians whose job it is to do things and have been prevented from doing some things. So I think if we continue with the different ways we do things, we will be able to address some of that. But we must remember that our staff, all of our staff, are exhausted mentally, emotionally, spiritually, physically, and we've got to have some time where they can rest and recover before we hit the massive challenge of the backlog. And I think as leaders, we've got to ensure that we manage, I suppose the technical saying is manage expectations, but it really is to stand up and say, yes, we will do everything we can, but we just need some time to recover. And I think we've got to ensure that that time is built in, and the recovery is based on that reality, and that we care for our staff. Because I think, and Suzanne's the expert, once we come out of this and we're on our way out, I think that's when a lot of this stuff is going to hit home, and that people are going to need time to come through this.
I would fully support all of the things that Maria has brought through there. And adding into that, I think the biggest takeaway for me from this experience in the last year is around holding staff well-being right at the centre of our radar. But without this, everything else is impacted in a negative way. So finding ways of maintaining this focus on staff well-being and resilience in a way that is truly inclusive, that is collaborative, so everyone takes ownership and there's a shared responsibility, but in a way that is also coherent, so it doesn't become too scattered and fractured. So holding it together in a coherent, coordinated way. Because I think when we do that, when we hold that at the heart of who we are and how we operate, we're best able then to serve our communities.
Yeah, a couple of points really relating to those themes. I think prior to the pandemic, staff sometimes used to feel guilty about looking after themselves, about putting themselves first. And, as Maria said, probably at times during the pandemic have still not paid sufficient attention to that. So I think a key thing looking forward for me is, as part of our culture, to reinforce that it's absolutely vital that we look after ourselves as staff, and as an organisation, we create that environment. But another look forward is what I've seen is, the innovation that's happened during this period has been amazing. And the way staff have, put their egos aside, put their turf aside, their professional rivalries aside, everything. And they've been amazing. They've just got on with doing the right thing to treat the patients who've needed them. And it's been absolutely, superb to be part of the team.
Thank you. How do you think the pandemic will change the services you provide in the future, and what will be the longer term benefits?
Responding to this question at a system level, first of all, I think that moving forward, we need to keep a focus on what I call the upstream. So what are the conditions that are required in the workplace that enable us to be well, that support our resilience and keep us healthy? There is a need for downstream intervention, reactive work, absolutely. So when staff are struggling, when they're burnt out, when they're stressed, yes, we need the right services in place to support them with that. But the more work we do upstream, the less of the downstream reactive interventions we need. So moving forward, I think that services will continue to provide that intervention treatment-based focus, but there'll be far more that's going on upstream, making the work good, making the conditions right. So whether that's about how much work we have, how we do it, how much control we have, how change is managed, how innovation is enabled, how we relate to each other, all of those things are absolutely crucial. So much more of a focus on those elements of our culture, if you like, how we do things. And then within that, there are other little bits like picking up on the learning and the innovation that Christine's mentioned, being able to deliver services remotely. Whereas before, perhaps we were very reliant on face-to-face interactions, either with teams or with managers. delivering training. So being a lot more creative and flexible with how we do things and taking that forward in whatever way is appropriate.
I feel a sense of responsibility to really embrace what Suzanne was saying in terms of how do we really think and keep centre in our intention the culture that we're trying to create, where staff can actually thrive at work, where they can, you know, it enhances their life rather than detracts their energy, so that, you know, you come to work and you feel that sense of pride and camaraderie, and you go home and you spread that joy with your families. So it's how do we really continue to grow that culture here in Hywel Dda, in this lovely West Wales paradise that we're not telling the outside world about, because we've enjoyed it all in lockdown. But no, there is something about how do you know, be a guardian of the culture, because it can be easy, and we see that now at times with some of the old bureaucracy trying to creep back in, or some of the old processes. There's a tension between slipping back and keeping a hold of what's really important for our staff and our patients.
Totally agree with Christine and Suzanne, particularly the downstream and creating that happy place to be and the right place to be. And it's a myriad of things, isn't it? It's about, you know, recognising and celebrating. It's about listening to staff. I know one of the things that we've set up a kind of a rest and recovery group, but bringing in the tourist industry, because although, you know, we live in an absolutely beautiful part of the world, as Suzanne pointed out, some of it is outside of the of some of our staff being able to afford it. So staff are saying they want, you know, a family day out, an extra day off a year to spend with the family, being able to access some of the facilities that are here, bringing in the arts and the culture and the green agenda, so that our workplaces are, because what it will benefit our staff, but also our patients, because it's hand in hand. And again, it's about listening and using the ideas and the knowledge of our staff, and enabling them, as they've done during this pandemic, to create solutions which are the right thing to do. And that includes their own well-being as well as the services for our patients. Coming into the health service for the first time about 9 years ago, I was so taken aback how hierarchical it is and how bureaucratic it is. And I think part of that is fell away during the pandemic. Not all of it, but a large part of it. And we've got to keep that going forward. And it's the same as the prevention agenda with the public. It's looking after yourself further down the line and creating ways to do that, to prevent the crises.
What are the risks that need to be managed?
I think one of the biggest risks is that we go back to how we were doing things before, and we kind of move back into the uncomfortable comfort of the old ways of what was familiar. So the challenge moving forward is to retain all of this learning, to retain this positive change, and to keep it moving in that direction. So not allowing that bureaucracy, that hierarchy to creep back in again. But along with that, in terms of a much more of a focus on staff well-being, working upstream and downstream, there is a risk that needs to be managed around not being able to reach all of our staff. So not relying on certain mechanisms of communication that might favour those who are digitally connected at work or at home, and it excludes others. So it's making sure that whatever we're doing, and whatever part of the river we're working in, however far upstream or downstream it is, that we are as inclusive as possible, and that we are really reaching out to all of our staff so that there aren't any voices that are missed. I suppose the risk is that we miss voices, and that we exclude groups of people who perhaps find it harder to have a say. So just finding ways to make sure that we don't fall into that.
Just one point I've made, which is a reflection on the level of intensity that people have been working at in this last year, and you sort of get used to this level of adrenaline, this level of anxiety in some ways, and this expectation that you're always on duty. I think there's a real challenge around how do we readjust ourselves and the organisation's expectations of what's reasonable, what's a balance to keep us well. And I think, you know, you can get addicted to adrenaline, so it's quite difficult to come down a little bit and think, actually, this is what normal is supposed to feel like. And it might feel really slow initially, but it's not. It's, you know, and it's that readjustment to what is a reasonable level and balance to maintain work and good health.
Any key messages for public services to take away?
Sure, everybody knows that at the very heart of any public service to work, it's about the values. So I would just say that kindness, that compassion, that respect for each other, listening, truly listening, and using those values to go forward in everything you do.
Just one for me, which would be trust your people. They will do the right thing.
There is no one right way through this, and it's really important that we find a way of listening, as Maria has said, and understanding that everyone's voice counts. Everyone's experience through this has been very different, and everyone's experience is valid. So finding ways of being human together, being able to really listen and lean in so that we can understand and appreciate each other's experience, finding ways of doing that, but understanding that there is no one right way. We just need to keep finding ways of doing it on a regular basis.